I think this one is really easy. Everyone knows the diagnosis. This is basal cell carcinoma. I just show you this classic picture. This one is nodular type. You can see forming this nodule. The classic finding is that even low power, we can know this retraction artifact. That means this nodule have kind of this separation between the stroma, and then the stroma kind of bluish looking. That is classic basal cell carcinoma stroma, bluish like mucinous material. And then mucinous material, they may have this bluish mucinous material around this blue nodule or even inside the carcinoma. And then classic basal cell carcinoma, we can see this palisading hyperchromatic basaloid cell. So when you see retraction side effect, mucin between the nodule and the stroma, also the stroma is also bluish mucin, intracellular mucin like this, that is basal cell carcinoma. Here's the skin photo of basal cell carcinoma. You can see it's kind of a papule, kind of reddish, looks like really easy to bleed. So this is basal cell carcinoma. And then here is another basal cell carcinoma, but this is another subtype that is the infiltrative type. So we can see all the classic finding for basal cell, like mucin, intracellular mucin, and kind of subtraction artifact between the stroma and the palisading basaloid cell here. Then, but we can see this next, just not forming next. They have this infiltrated growth like this. So usually the dermatology will treat this infiltrated growth basal cell carcinoma, doing a surgery to just make sure to take it out. Here's another variant called fibroepithelioma of pinkus basal cell carcinoma. This is a dome-shaped nodule pushing out from the skin. Then they forming this kind of anastomosing, almost like necked structure. And then they do not have classic basal cell carcinoma stroma, not really mucin bluish. But when we zoom in, we can see this basaloid palisading cell. They're not forming this nest, they're just forming this strange anastomosing structure, and then kind of mucin inside this area. You could not find any aqueduct because there is another mimicker called the cystinocytic adenoma. You may see aqueduct in that entity. So this is just another variant of basal cell. You can see basaloid palisading cell in the periphery with this mucinous stroma inside, kind of subtraction artifact. So they also have some feature of classic basal cell carcinoma.